Exercise and vestibular ocular motor symptoms. So they did a VOMS test pre and post exercise. So we often, as part of our protocol, will do VOMS if we don't have a baseline on somebody. So if somebody comes in with a concussion and we've taken them through the entire return to play strategy, the last thing we do is the Chicago Blackhawks test. Then usually following that, we'll rerun all their baseline. And the reason we do their post-injury baseline in an exerted state is for the same reason I just showed you, is that exertion can increase symptoms, and it's been shown to increase neurocognitive or decrease neurocognitive function, King-Devick testing, that type of thing. So we want to do it. It increases the sensitivity potentially of some of these measures. It didn't show it with BES and memory on the previous study, but it can increase potentially symptom severity and other measures of cognitive function. So if they don't have a baseline, we'll often run a post-exertion VOMS test just to see if something's there. Now, we don't know how exercise affects VOMS, and this study kind of shows that. So 36 concussed adolescents, again, not a huge sample. They were within 30 days of their injury. They did a pre-exercise VOMS and then a post-exercise VOMS. They were looking for an increase of 2 or more points. For the exercise protocol, they did 16 minutes on a stationary bike. Then they did medicine ball tossing and then medicine ball wood chop. So a bit of kind of core activity, a little bit of motion, rotation, that type of thing. And they did a bike protocol as well. So they did, they also looked at just total symptom severity scores, etc. So prior to the post-exercise VOMS identified 29 participants as positive in at least one VOMS item, compared with 21 participants in the pre-exercise. So there is a little bit of a difference there. We're picking up more dysfunction post-exercise than we are pre-exercise. Compared with pre-exercise VOMS, the post-exercise VOMS was associated with identification of participants who were previously negative on VOMS. So you take somebody with dysfunction, you test them in a non-exerted state, and they're negative. They don't have any increase in symptoms. We exert them, and we're now picking up, dysfunction and increased symptom reporting. Largest change of classification from pre-exercise negative to a post-exercise positive was smooth pursuits. The smallest was near point convergence. So it seems that near point convergence is fairly stable before and after exercise. Smooth pursuits seems to be the most affected by exercise. So if you wanted maybe just a quick and dirty, maybe you just do smooth pursuits, but I'm not recommending we do that. But conclusion, dynamic exercise protocol performed prior to VOMS assessment may increase the detection of post-concussion vestibular and ocular motor related symptoms that may be missed if VOMS was performed at rest. So again, this kind of almost reinforces the fact that we've already been doing this. Is if you don't have a baseline and you're going to run a VOMS as a return to play clearance measure, you're going to do the Blackhawks test prior to anyway and clear them if they're a contact sport athlete.